roll call.
Okay, roll call. Clarence Campbell,
Here.
George Busse,
Here.
Richard Huber,
Here.
Matt McKenzie,
Here.
Laura Negro,
Here.
Dr. Keller,
There.
Dr. Horning,
Here.
Laura Cruz,
Here.
Joy Hendrickson.
Here.
Okay. Minutes of the last meeting. Should have them. Anyone have any additions or corrections?
Second.
Motion by George, seconded by Dr. Keller to approve the minutes of the last meeting. All in favor? Aye. Opposed?
Aye.
Oh, that must be in favor, I think. The internet delay. Motion approved. Public hearing on DATCAP licensing fees. We need a,
Yeah, move
Motion
to
to
open the
vote.
hearing. I'll second.
do we need a voice vote?
Yeah.
Yeah. Go into public hearing. Yeah,
Clarence Campbell,
yes.
George Busse,
Yes.
Richard Huber,
Yes.
Matt McKenzie,
Yes.
Laura Negro,
Yes.
Dr. Keller,
Yes.
Dr. Horning,
Yes.
Laura Cruz,
Yes.
Joy Hendrickson.
Yes.
We're in the public hearing. Anyone wish to make comments? Anyone online wishing to make comments on the approval of the licensing fees, the AdCap licensing fees? Otherwise, we'll keep the hearing open and then we'll go on to regular business and then we'll have to remember to close the public hearing at the end. But if anyone does appear and want to make comments. Now, public comments pertinent to agenda items, resolutions, or ordinances on our agenda. Anyone wishing to make public comments in the public comment portion of our meeting? Anyone online? Doesn't appear to be, so we'll move on to the next item on our agenda, and that's the 2023 year-to-date expenditures. Amber? There she is. Amber, we're at the expenditures, 2023 year-to-date expenditures.
Are you guys able to hear me?
No, we can.
Okay. My headset must not be working, so sorry about that. And my camera's not working. Gotta love technology. Are you able to share what's uploaded on the screen? I don't know who is manning the.
I will. Yep, I will.
Okay, the summary. While she's pulling that up, honestly, too soon to tell. So with the summary that you guys got, we're honestly right where we are at last year at this time. I remember us being at 85,000 overall among the whole county, over budget at this time and looking really good, but it's just too soon to tell because so this is everything through December that was received, both revenue and expenses. But then of course, the expenses we continue to pay out through January and February and sometimes into March, and then our revenue we will receive into April. So I'm not going to have a perfect picture to what our 2023 is going to look like and until we get the rest of rest of that data in. So in April, we'll have a better idea. And just looking overall, when I look at each department, we just have everybody's kind of right on budget or under, except for children's, but we're all aware of that. We talk about it every time. And youth aids, that's where that's over 200,000. And another one that you might notice that child support is over on the levy, but I don't have any major concerns there too. And Kelly, feel free to add anything too if there's anything you have to add, but
We
you know,
have not gotten our funding on our reimbursement for November or December yet, so that still is coming in.
perfect. And I knew you hadn't gotten December, and there was a reimbursement we just got at the beginning of February. Well, this is only everything we have through the end of December, so that number will change on the next one too. Other than that, does anybody have any questions on this?
Clarence? Matt?
Yeah, I'd ask, what's going on with the travel and training? Why are we so far off on that? And we're halfway through the year?
Let me see. You know, I can't really say for sure, but I'm kind of thinking because of the couple years before that, there wasn't a lot of travel. That probably that budgeted number might have been budgeted a little bit low. And that now that people can travel, there could be a little bit more of that because we have had a lot of training, but I can dig into that too a little bit more to see if it's specifically one department that's really over budget. I'm just kind of quickly glancing through here to see if anything's like a major pledge, because some are under, some are over.
And I think we had made the assumption that with the technology, they being a lot of our state agency partners would allow for us to do virtual meetings. The northern region, because we're furthest away from a lot of the central and southern parts where most of the meetings are held, is very supportive of that. They've been advocating with our state partners, but most of the bigger agencies have just decided they want to go back to in-person trainings. So whenever it is an option for us to attend virtually, we usually do. And when it's not, and we have to go. So I think she's right there. We can dig a little deeper, but I think each department kind of underestimated the availability of virtual meetings this year.
This is Laura. When we have these budget items, can we have also last year compared to this year so we can see the tracking from year to year?
Yes. On the next one, I'll put on there, I also do like those reports, so I will combine 2022 is on here and make a little bit of a different summary, try to put it all on one page so you can see comparison.
Thank you.
You're welcome.
Any other questions? All right, thanks, Amber. Bayfield County Housing Outreach Specialist. See Kelly is online.
Thank you, Kelly. So Kelly is
Hi.
joining virtually, and she has her own slides to share. She's going to give you an overview of what she has done as an outreach coordinator for Bayfield County through the UW Extension for their housing. So take it away, Kelly. Thank you so much for joining us.
Yeah, thanks for the invitation. There's a lot happening around housing in Ashland and Bayfield counties for sure. And I've got a lot of information in this slide deck, but I don't want to take up all of your time. So if I can kind of get a sense of the information that you're mostly looking for. Like I would like to give you sort of the lay of the land, context of what's happening here. But are folks particularly interested in like what you can do at the county level or the local level, homelessness issues, the existing supports, anything of particular interest? I would appreciate if you want to flag those for me, and then I can zero in on them. Feel free to drop them in the chat. But oh, did you have something, Laura?
I'd just like you to start with the county stuff if you can, and then if you could share the deck with the HHS so that way we could upload it.
Okay, sure.
Thanks.
Okay. Sorry. I'm gonna go ahead and let's see if I can share my screen. Who has to give me permission, I guess, to share my screen?
Probably me.
So click on the arrow by the side of the share screen. And with multiple people can share. Yep. There you go.
How about now, Kelly?
I don't see anything changed. Well, shucks. I did email you a copy too if you want to pull it up, Terry, if you have it handy. Otherwise, yeah, I don't even see an option for sharing.
I wonder if she doesn't see the table at the bottom. If she puts her mouse down by the bottom,
Oh,
that's good.
there we go. I think
Okay.
now it showed up. All right. Apologies. Now let's make sure I'm gonna share the right thing instead of all of my open tabs. All right, there we go. So, thanks again for the opportunity. And as Terry said, I am Kelly Westland. I'm the Bayfield County Housing Educator with UW Extension. And just a little bit, I think you all are familiar with the role that Extension plays in our communities, bringing the resources of the university to every corner. In the Community Development Institute, we work on a lot of the issues facing our communities, and we have a unique opportunity to work on housing with this pilot position being based in the Schwamingen Bay region. So to give sort of a quick snapshot, if I may, this housing crisis is nationwide. It's not just us. According to the National Association of Realtors, we're now coming up on close to 7 million units that we're short as far as housing units across the country. And in Wisconsin, that translates to a little more than 250,000 houses that we need to build in the next decade. That being said, with the increasing prices of all kinds of housing, nearly a quarter of homeowners and just under half of the renters in Wisconsin are considered to be cost burdened. And I imagine that most of the folks in this room are familiar with that term, but it means that according to HUD, you're spending more than 30% of your income on housing related expenses. So there are some corners where people are spending upwards of 50%, and that is an extremely cost burdened individual in those cases. Locally, I think that you have all probably heard the anecdotal information about employers having difficulty attracting, recruiting workforce, partly due to the lack of available housing or housing that's affordable for folks working those jobs. And of course, in a region like this, that means that sometimes it's more difficult to find folks to work the jobs that require a person to be present. So it makes those remote work options a lot more attractive. We've seen in some communities, sort of this not in my backyard response because people have preconceived ideas of what affordable housing looks like and what that might mean for their communities. And this growing issue is really affecting our abilities to provide services and the quality of services that especially local governments are able to provide. So we do have to talk about affordability when we're talking about any kind of housing or economic development because it is a key piece of the work that needs to be done. So again, this is more local context. And this region has an aging population, which again, I'm sure is not news to anybody in that room, right? But we do lack housing for independent seniors. There are some options available in our region, but most of them are waitlisted. There aren't a lot of new options that have been built recently. And we're not seeing so much of like young people leaving necessarily. We're seeing a lot of older folks that are choosing this as a retirement destination. So we have people of retirement age that are coming here because as they are wrapping up their careers, they've decided that they want to spend more time at what used to be their vacation home. So this chart that you can kind of see how over time, both counties are getting an increasingly large share of the total population in that 55 plus age group. I will just note that in the 2030 column, those numbers were from the Department of Health Service projections a few years back, and we already know that the rate, at least in Bayfield County, is actually increasing faster than what they projected. Bayfield County is expected to be the eldest county in Wisconsin by 2030, and I can't imagine that Ashland is very far behind, frankly. So this is a really interesting dynamic. We're considered a rural recreational gateway community. And that means that, you know, folks that want to come spend time here often have some interest in enjoying the outdoor amenities that we have to offer, whether that's the Apostle Islands or the National Forest or just any of the other, you know, we have a lot of green space and folks come here on vacation to enjoy that. So what that means is that we see a lot of vacation homes. That's one piece. And then there has also been kind of a really growing portfolio of short-term rentals across the region. And if you kind of, again, track this chart, the census qualifies vacant housing units as units that when they go around and conduct the census, they're not occupied by a long-term resident. So vacation homes or seasonal homes, short-term rentals, homes that are currently up for sale or rent or being prepared for sale or rent, places that are undergoing renovation, maybe something that's tied up in legal proceedings, or on, you know, rare occasion, it might be somebody's using a building for storage or for some other reason, rather than using it as a dwelling. And the most recent numbers tell us that we have a pretty significant number of housing units that are considered vacant in the region. So Ashland County, it's not quite as bad as it is in Bayfield, but the most recent numbers tell us that close to a third of the housing in Ashland County is considered vacant because it is being used primarily as second homes or short-term rentals. In Bayfield County, we can back that number up and say that of those 43% that are considered vacant, it's at least 90% of those that are indeed second homes or short-term rentals. So the reason why I think this is really important is one, it's one of the major factors that limits availability of existing housing that's already here in the region. It's also one of the reasons that the cost has been driven up as much as it has. We've seen this dynamic where first of all, people over the course of COVID and some of the other things that have been happening in the last, 5 or 6 years, people are leaving some of the larger cities. And if they have the ability to work remotely, then these are often higher wage earners who will buy a house in Ashland or Bayfield County and work remotely with their job that they had previously in the bigger city. Which is fine. It's just that is a whole class of people that has more ability to make an offer on a new home above asking price without having to go through some of the things that will delay any other potential buyer. So that's a part of it. And because of this sort of this explosion of new short-term rentals that we've seen recently, there are dashboards essentially for real estate investment companies. Sometimes these are, corporate groups, sometimes these are individuals, but they can look at a map across the country and see the regions of the United States where they can make the best investment, where they can turn the best profit using short-term rentals, Airbnb. And this region shows up as a place with a lot of opportunity on that map. So if you are somebody who lives in California and a single family home is selling somewhere close to $500,000 and you see one listed in Ashland County for 170, that seems like, that's a great deal. Why wouldn't you jump on that? And you're not worried about offering more than asking price. So those pressures are all sort of coming together to drive up the cost year over year for the average median home sale price, which you can see pretty clearly here. Ashland County, it's stark. In the last 5 years, the median home sales price has increased by 206.5%. So the cost of buying a single family home has doubled, more than doubled, essentially. And I don't know if any of you are tracking that closely, but that it's a cause for concern as far as I'm concerned. So, how do we approach this, right? And I just want to make sure that I also say that, you know, it's more of a challenge in remote and rural areas like ours, partly because developers can't get the economy of scale that they're looking for. I know that the development in Ashland is, and Matt, correct me if I'm wrong, 50 units, correct?
Correct.
That's right.
Okay. And there's a proposed development in Washburn for 40 units. And at least in the conversations I've had with a number of different developers, 40 is sort of the floor of what will attract them to a given community. And as we've done work out in more rural corners of both counties, what we hear is that, you know, these folks feel like they need maybe 8 to 12, you know, maybe a dozen units, and that's not enough to attract a big developer. So unless we can kind of cobble together enough projects to make it worth their while, it does present a kind of a unique challenge to rural communities. It's just further to travel. It's further for them to bring their supplies or materials. And it's also the added cost of having to house employees while they're here doing that work sometimes. So we also often see a shortage of skilled labor in the region. Again, right about now, most contractors that are doing this work are booked out about 2 years. So this is moving pretty slowly, and even going for some of the low-income housing tax credits that will help make projects more feasible in rural communities. They're often tied to various things in the scoring criteria, like proximity to public transportation, to healthcare services, to grocery stores, post offices. And if you're in a place like, I'm just going to pick Ulu because I feel like that might be safe and not in Ashland County, but Ulu doesn't have, you know, a grocery store or, you know, a BART route or anything like that. So they're not going to score very high when they go chasing LIHTC credits. And then just that housing is a complex issue. And I chose this picture specifically because I don't think that this would fly at all anywhere near here. This sort of arrangement, and maybe I'm wrong, but there are places where the weather and the need is such that you can put up a bunch of small, you know, tiny homes in a parking lot and call it, you know, a solution, but it's just not going to work everywhere. There is no silver bullet. The approach that we've been taking in Bayfield County, we're referring to as the silver buckshot. We're just going to kind of scatter all of the effort and see what actually pans out, because we just don't know which strategies are going to pan out. And if something works in one community, that doesn't guarantee that it's going to work somewhere else. So what can we do? Again, no silver bullet. However, I've got a few things on this list that I'll go through individually. The first one is, you know, if there's capacity within your entity, I would suggest hiring a person and making it their job. There are a lot of things that don't get done unless it's someone's job. And so in Bayfield County, of course, they created this position, which I've been in for about a year now, and they've just extended it through 2026. So part of the role that I've been doing is research, but it's also working with small townships around the county to get them to a point where they can put out a request for proposals for developers, for example. Sometimes it's writing grants. Sometimes it's just bringing opportunities to their attention, or even convening groups of folks to start having some of these discussions. The county also partially funded a full-time position at the Housing Authority. I don't know if Ashland County makes any kind of investment in the Ashland County Housing Authority as far as staffing is concerned, but we realized that that was really it was a capacity issue. And if we want to be able to find the resources to preserve or improve or expand any of their properties, we needed to be able to find those resources. So that $30,000 a year investment gets a part-time staff person to a full-time position. So that extra 20 hours a week was enough for the executive director to carve out some time to start chasing some of these other resources to help get expansion underway. And this year was the first year that they put that $30,000 in, and the Housing Authority was able to secure an additional $84,000 worth of investment to do things like, you know, repairing a roof and some weatherization, some energy efficiency measures that are also going to reduce their operating costs going forward. And so that's a pretty substantial return on investment, and they're going to continue to build on it, which I think is great. And the last one there was a housing grants outreach intern in partnership with Northland. And that came about because there are programs that you're all probably familiar with, the weatherization and community development block grant funds, the revolving loan funds that homeowners can take out to fix up their homes. And they were just being underutilized. Northwest Regional Planning Commission manages, I believe, 21 revolving loan funds for different communities in northwestern Wisconsin. But there have been several years in recent years where they haven't utilized all of the funding that was available. And if there are resources there that we can put to work in our communities, I think that we should be doing what we can to raise awareness and make that happen. So this is kind of speaking to that issue, looking around to see what is the low-hanging fruit. I was glad to see on the Health and Human Services website in Ashland County, the link to the USDA rural home loans, 1% loans for low-income folks, especially if they're elderly people that would like to stay in their homes longer and need to make some modifications. That's really important. And in fact, the senior population, part of that aging demographic, that is part of the puzzle, right? We have a lot of older folks who are still in their single family homes, and they would relocate to a different situation for independent seniors if it was available. But since we don't have a lot of those options here that aren't already waitlisted, we have a lot of elder folks who end up staying in single family homes longer than they'd like to. And oftentimes, they either can't manage or can't afford to do the ongoing maintenance that is necessary to keep that home in good order. So being able to access some of these other resources like the USDA loans to help them fix that, keep them in good shape is really valuable. Of course, there are also the weatherization programs that are administered through the County Housing Authority. And there have been some situations, especially when we have older renters who have been good long-term tenants who potentially, I've had landlords contact me and say that they have to raise the rent just because the cost of everything has increased, right? And I can't necessarily blame them for that. But if they've got a long-term tenant that is low income that they want to keep, then it's worth mentioning to them that if the landlord is willing to go through the process to accept housing choice vouchers, then that might be a really good way to help kind of cover the gap between what their tenant can afford and what the landlord needs to make on the monthly rent in order to keep those folks in that home. So let's see. The housing readiness process. This is something that so far has been pretty fruitful in Bayfield County. I don't know if you folks were tracking it, but a few years back, we had some folks that were affiliated with the Housing Authority Board who were making presentations in some communities where the Housing Authority had existing properties, and mainly just to kind of get a temperature in different communities to see if there was interest in expanding, the number of units that the Housing Authority had to offer in these communities. And in some cases, there was a lot of backlash, partly because people have an idea of what affordable housing is or low income housing, and a lot of folks don't understand the process that an applicant goes through to live in some of these units. So instead of sort of bringing this idea from the outside and saying, hey, consider this is based on a model that has been really successful in Iowa, where they start in a town, gather a few folks like yourselves or other people that might be stakeholders in the housing issue and get them to sort of sit down and look at the need. So, who are we trying to serve? Is it primarily a senior population? Are we talking about homeless folks? Are we talking about veterans? Or is it young families? Whatever the case may be in your given community. And then trying to do the work to figure out how many units are actually going to make a difference. How long is that wait list for, your new housing development? How often do we have vacancies in available rentals, or how long do houses sit on the market? That sort of thing. So once you have an idea of how many units will meet your need, kind of doing the parcel inventory to look around. In the county's case, it might be looking at county-owned or even municipal or town-owned properties and figuring out where those properties are most likely to be buildable and have good access to existing utilities, because the utility investment is insanely expensive, right? If you have to put in new power and water and sewer, that's one of the big hurdles for new development. So if you can find places where those resources are already nearby, then that's fantastic. So at the end of this housing readiness process, ideally, this ad hoc housing committee is a community-driven version of doing this work and then being able to put together a request for proposals that they can put out for developers. If we know that in the end, we need a dozen units to serve a senior population, and here are a couple of parcels where we think it makes the most sense, then that's something that at least gets you a little bit of a leg up there so that you know exactly what you're asking for. And of course, a big part of attracting development is reviewing and updating the zoning code. So there are a lot of different folks who weigh in on this, but the estimate from most developers and big trade organizations is that the zoning can contribute up to about a third of the cost of the total cost for new development. And that's oftentimes in terms of like delays for various process related things that are part of the permitting process. So there are a lot of things that we know can reduce the cost, and I'll come back to this later. But this is one of those places where, for example, I know that in some of the cities that we've worked with, I guess there are only 2 in Bayfield County, so that does narrow it down for you quite a bit. But if there's a house, right, that is a large house that could be divided into a duplex, the way the code is written currently, dividing that single family home into a duplex, according to the zoning, would require twice as much space to put it on, right? So you'd have to go through the process of getting a variance or a CUP to be able to make that allowable. But if there were a way to amend the ordinance to just say that as long as the multifamily unit or duplex occupies the same footprint, that they don't need to go through that process, then that's going to save time and money for folks that are willing to do that work. The other thing is that government can take a lead role in new development, because that's the facts. Nobody's coming to save us. They have plenty of work to do in other parts of the state. So it's important, I think, for us to kind of look around and say, what makes an opportunity attractive to developers, and what are the things that are standing in the way? So this example that I've got up here right now is the Washburn proposed housing development that is near the Northern Lights building on the east side of town. And it's county-owned land. It has some funding coming from the city of Washburn in the form of dollars from their affordable housing extension on their TIF district. And we're working with a nonprofit developer, Scenair Solutions. And so the fact that Scenair can come to this and have already have the site control of the land and some of the funding that will help them do this work, that really sweetens the pot. There are cases in other communities where they also work with potentially, a department of government. So if this was something that was intended to have more supportive services, maybe they include in part of the community building offices for the personnel that will provide those supportive services. And there are all kinds of ways that I've seen people kind of fold in a potential revenue generator or service provider to the same location as a convenience to the residents, but also as a way to make the whole development pencil out. So, really think about who might have a stake in this. And increasingly we're seeing, employers who have skin in the game because they're tired of trying to recruit folks and having trouble doing that because of housing. So, even if you're putting up a couple of duplexes at this point, there's so much demand in the market that every little bit helps. And we need it across every income group. So another part, of course, that you guys can do at the county level is making some of those housing forward policy changes. And this is one that's sort of just around the margins, but looking at the numbers in Bayfield County as far as short-term rentals are concerned, and the fact that 44% of our housing units are considered vacant, most of which are in vacation or short-term rental use. They passed in June a resolution that whenever a property sells via tax foreclosure at the county, they include deed restrictions. One that prohibits short-term rentals at that property for at least 10 years. And then the other that is basically, it requires that they build something new on a buildable lot within 24 months of purchase. The idea there is that, if I have a tax foreclosure property that's adjacent to my house, then maybe I just want a bigger yard. So I'm going to buy that cheap property off the tax foreclosure list, and then it's just going to sit there. So we're not actually promoting new housing development if we kind of leave that as is. And this one also had another provision that's if there's an existing house on the property, then it should be a primary or long-term residence within 6 months. And then if it was a buildable lot, and of course, these have just gone out into the field with the home sales. And so far they haven't reduced the value in terms of what people are willing to pay for these tax foreclosure properties. But yeah, I think enforcement is going to be a question, and it's just something that we're going to have to sort of wait and see and track it to have a better sense down the road if it actually did spur somebody to, you know, put up a house on that lot that they bought or to move into that house. But either way, we know that it won't be a short-term rental, so somebody's going to be living in there unless it's vacant for, you know, that first 10 years. This last year, the legislature did pass a pretty significant housing package. And I won't go through all of the details, but there are 4 revolving loan funds that received a little over $500,000. And some of these are going to be easier for rural communities in northern Wisconsin to access than others. But here's the important part for local government. Before anybody in Ashland County can access these dollars in the new WIDA revolving loan funds, the county or the local municipality have to have made changes to their zoning ordinances in order to essentially reduce development costs and expedite approvals. So they have to have made those changes since January of last year, or they will not be eligible for these new funds. The same is true of updating the housing element of a comprehensive plan. So Ashland County, I don't think has undertaken that work yet. But that's something that will have to be completed before developers in Ashland County will be able to access these WIDA dollars. So I guess if you're looking for things for your to-do list, that's one that might want to come to the top. And then lastly, some of these innovative things, we're looking at a lot of different options and kind of pouncing on opportunities as they present themselves. So some of this is exploring the Community Land Trust, which I'll talk a little bit more about, but local housing funds. So there are many communities that will just allocate either general operating dollars or maybe it's a percentage of a development permit cost or some other source, but it is essentially a pot of money that you create at the local level that comes with a lot more flexibility than some of the other dollars that are available from the state or federal governments. Oftentimes those might have income requirements or all kinds of reporting and administrative stuff. Whereas the local housing trust funds, if you have a committee of people that decides that you want to prioritize you know, rental assistance or some affordability like subsidies for new home buyers or whatever, you can decide what is the priority in your community. And then this is just more flexible money that you can use. It also in some places has been used to cover the development gap to help attract new development and help them make their projects pencil out. Also looking at some of the advancements in modular home production and even 3D printed housing, different materials. There's a lot of innovation across the country right now, and you know, it's good to sort of tune into that here and there and see what might work in a region like ours. So the land trust, though, is one that isn't growing in popularity across Wisconsin. There are well, the 5th one that incorporated is the one that is serving Ashland and Bayfield counties. So it was incorporated at the end of last year, and it will be operational as a 501c3 nonprofit March of this year, which is next month, soon. So this model there are 300 of them across the country. It's been useful in terms of maintaining affordability for home buyers. So it's a nonprofit organization that takes land off of the speculative real estate market. We'll buy a property and separate ownership of the house from ownership of the land beneath it. The Community Land Trust maintains ownership of the land, and then the house is sold to an income eligible person. In the case of the local version, it's at 120% of area median income or lower. So trying to get into some of those like missing middle options, partly because the median home sale price has so quickly outpaced the median income in our communities. So when they separate those two things, the land trust puts in place a restriction that they use the ground lease to enforce that says that home can never be a short-term rental. It can't be a vacation. And if say the house is worth $200,000 on the open market and the qualified home buyer can only afford $150,000 of that, then the nonprofit will subsidize that gap. They'll put that $50,000 into the home to make that home affordable. but that $50,000 never leaves the property. It stays with it. So as the property increases in value over time, so does the value of that subsidy. And that way it keeps that home affordable in perpetuity without additional future subsidy. And because it's resale restricted, that means that the home buyer can only ever claim, 1% of equity per year. So it's got both of those sort of measures in place to make sure that over time it stays affordable for people making the median income in our community. And these have been really successful in a lot of places, but this is so there are two of them that are kind of large rural areas in Wisconsin. One is Door County, and theirs formed about 1.5 years ago. And then there's this one, it's called Check Built, which actually, there you go. That's Check Built. And the BUILT stands for Bay Area United Impact Land Trust. This one did receive some funding from WIDA to get the organization up and running, and was recently awarded a technical assistance grant from Minnesota Housing Partnership. So we'll be hiring somebody to help operate this organization, acquisition and rehabbing new homes, and potentially even some new development, especially in corners of these two counties where we see the availability of workforce housing as being a particularly challenging contributing factor. I don't know about, I've heard it out of cable. I'm less familiar with what's happening in communities around Ashland, but Bayfield and LaPointe, it's the same way. I guess LaPointe is Ashland, that in the high tourist season, they're having difficulty keeping their businesses open, as much as they'd like to, because they can't find the workers who can have those jobs and afford to live in the area. So people are commuting long distances to come in. So these businesses end up being open half of the week during the high season and missing out on a lot of economic opportunity. So new construction is really kind of surfacing as a priority for this organization. So I'm excited to see what happens with it this year as we go forward. And really, I feel like I just threw a ton of information at all of you. And I wanted to check and see if anybody's got questions or other things that you might be interested to hear about.
Bravo.
Thank you, Kelly. That was wonderful.
Yeah, very good. Anyone have any questions for Kelly? Matt?
Kelly, when you say independent housing for seniors, can you give me a vision of what that looks like in our community currently? Is this like the new apartments where Salem Baptist burned down, or what does that look like?
Sure, like those are an example. But when we conducted a study in the region in 2021, that was actually some of the questions got to what people were looking for, right? So let me back up. So in that study, we found in many of the communities where we surveyed that like half the population said that they expected to have them or someone in their family would want to live in low or no maintenance housing for independent seniors within the next 5 years. So again, this was done 4 years ago, but when we asked about like which features made it, no or low maintenance or attractive to these populations, it's typically they describe a single floor home that is a 2-bedroom, 2-bathroom, or 3-bedroom, 2-bathroom, but usually it's at least 2, even if it's a single person household. And then they wanted a garage, just, to be able to have some storage space or something out of the weather. They don't want to have to, clean the snow off of their vehicle in the driveway. So, yeah, really those were the main amenities that they were looking for. I know that as far as the development that we're exploring up in Cornucopia, they're looking for something that is in close proximity to the daily living amenities that seniors will want, even if they don't have transportation of their own. So walkable to the grocery store, post office, church, that sort of thing. And then, yeah, mostly it's that we're thinking about mobility issues so that they can age in place. Something that is designed in a way where if somebody finds themselves in a wheelchair, that they can still stay in their home. And that if they need to bring in somebody who might be a live-in care provider, that there is a second room available for that person. So yeah, I don't know if that answers all of your question, but it's sort of a flexible space where people can age in place and kind of address those expected needs in advance.
Thank you.
Any other questions?
I got one thing.
Rich?
What do trailer houses have to do with any of this? Is this feasible for a trailer home?
For trailer homes?
Yeah.
Thank you. That's a good question. So, one of the problems that I keep running into is that a lot of these help for homeowner programs aren't as available for manufactured homes, right? They, especially if they are placed on property that they pay a short-term like a month-to-month lease on. So as we're looking at the various options that can bring, housing units to market faster, we absolutely have to consider trailer homes, manufactured homes, and of course, the standards for those have changed so much that between modular and prefab homes, they look a lot like any other structure at this point. They're just made off-site and then, brought to the slab and hooked to utilities. Partly the issue with mobile homes is a zoning issue. Depending on what community you're in, they might have some stricter regulations on, how many they can have or like how much space they require, that sort of thing. There is a really interesting model that has taken off in some corners where they set up what we used to think of as mobile home parks as a cooperative ownership. So every person who has their home in that park is a part owner, and they pay, dues like it's a co-op, but then it's a home ownership thing instead of a rental. Partly this has gotten traction because investor groups they'll buy up a mobile home park and then they raise the rent, and if somebody can't afford to pay that, then they get evicted. Otherwise it's expensive over time to do the maintenance, but I think that we have to think about, yes, the manufactured prefab and modular and SIPs panels, some of these other alternative options to get housing that is ready for people to move in as quickly as possible without breaking the bank, frankly, because right about now building a new house is close to $300 a square foot. So even if it's not a big house, it gets expensive very, very quickly. And so options like that are much lower cost, as long as we can do it in a way that, what we're putting up is durable for Wisconsin winters and is going to, last a little while for folks. I think that that's something we have to incorporate.
Thank you.
Anything else? Okay, again, thanks, Kelly.
Yeah, thank you.
We'll move on to public health updates.
All right, so I just wanted to share a few updates for what we've had going on for public health. One of those updates is just kind of a general staffing update for what we've had for some of our staff. Just trying to ensure that we have optimal performance within our programs and our individuals, because they're so cross-trained, maintain their area of expertise. So some of the training that our staff have completed over the last several months, we now have a child passenger safety technician certified on staff. Our environmental health specialist has completed her prerequisites and actually passed her examination, so she is officially a registered sanitarian. So we do have an RS on staff again. 3 of our nurses were able to participate with a day-long training put on up in Douglas County. So they now have infection control risk assessment certification. So very lovely title for that one. And then as when Jean Tyndall had retired in the fall, she was our on-staff lead risk assessor. So we did lose that ability with her retirement. So one of our nurses has completed the training for her lead risk assessor and the lead inspector initial training. So with those 2 trainings complete, she's able to take the examination for the state for what it's called a blue card. But that will then give her the official title once she has that for her lead risk assessor. So we will then have that person on staff again with licensure from the state. So they've been busy with their continuing education. And then I just wanted to touch base on what we've had going on for immunizations, specifically for influenza rates for this flu season. In the school setting, we administered 240 doses. That is actually a significant decrease from the previous year when we had administered 378. This is actually the lowest number of doses we've administered in the school setting since 2020, which in that year, we actually had to cancel several of our clinics because of the change in format due to COVID. So we weren't able to do the in-school setting for several of our clinics, and we still managed to administer 323 doses that year. So only being at 240 this year is a significant drop down. We've also seen a decrease in general public vaccinations as well. This year we gave 235 doses. Last year we were at 324. And it's kind of been a countywide, it's not just us as a immunization provider. Ashland County is currently at 34% for the number of residents who've received a flu vaccination. This is consistent with the state rate of 34%. However, in the past couple of years, we've steadily seen this percentage going down. Last year, we were at 41%. 2 consecutive years prior, we were at 46% for vaccination rate. So it is steadily going down. We are seeing increasing flu activity again as the second wave with influenza B. And this is fairly common of what a typical flu season would be. Flu season officially goes through May, but given what the weather is like, it's essentially right on time to be seeing the second wave of influenza coming through. So it's not too late. We still have flu vaccine available if anybody is looking. And seeing this, we did do a process improvement just for our staff to help facilitate vaccinations for individuals. We partnered with the Autism Society of Greater Wisconsin as part of their vaccine education initiative. So this is a nationwide program that helps to address systemic barriers while promoting vaccine education, confidence, and access. So all nursing staff have completed the vaccine education initiative training, and this training is designed to help bridge the gap so that we are equipped with training resources to address unique healthcare needs of individuals with autism and different disabilities within the community. We received several vaccine support kits as part of this training, and these kits include different sensory items that might be able to help with the vaccination experience, whether it be a fidget spinner, a shot blocker, noise canceling headphones, sunglasses, little buzzy bugs, which help to reduce the pain and the sensory experience that an individual might have while receiving a vaccine. So it helps for individuals who are neurodivergent or on the autism spectrum, or if you just happen to be an individual who is definitely afraid of receiving a shot, some of these tools might be able to use in those situations as well. So we're hoping that that will kind of just general experience, and we're hoping we'll be able to take that into the schools in the years to come, that will help improve some of the childhood immunization rates for school based there.
So can I ask you before you move on, what did you call this item that, and I'm sure Doc, you put it on your arm and it gives them a little shake or something and then they don't feel the shot, is that?
Essentially, yes, they call them Buzzy Bees. So it's a cute little child friendly design where it's we have 2 bees and a ladybug. You can also put a personal ice pack on it. But essentially, and it works great for little kids because you have your bug who's going for a walk and then he hangs out up here for a minute. And then the buzzy bug's gonna come sit up on your shoulder. And while the buzzy bug is sitting on the shoulder, it's vibrating, and they actually vibrate pretty good. So you can administer the vaccine, but that vibration will essentially disrupt the nerve pathway enough that it's going to decrease the
I didn't even
pain.
try that.
But then once
It doesn't help me though, because she always uses the big rusty needle.
I've never heard of such a thing. That's pretty neat. Thank you.
So yeah, we have a few of those available now, and we're hoping it'll go over well, like I said, in the school setting for some. I mean, we've had some kids who, their parents sign them up for the vaccine and the children have other ideas. So, which, my own is one of them, so I totally get it, but. Just a couple of other updates then, for our public health vending machines, we have received confirmation. The first one is in shipping. It's estimated to be delivered on the 29th. So hopefully next week we will have a vending machine delivered to the Ashland Fire Department. So it will have 24/7 access. It'll be located in the vestibule, and we'll have that start with Narcan Go kits, the TerraMed disposal bags, and fentanyl test strip kits. The second one is on order. We're just waiting to finalize a location, and we've been having conversations with the Bad River Drug Task Force on potential locations for where that can go. Just waiting for an official address to send that one to. And then the last update is the mobile mammography unit will be returning to Marion Park in Glidden again on June 13th. There are 10 appointments available for this unit. The caveat is we have to have all 10 appointments filled for the unit to actually make a scheduled appearance this year. So if anybody's in need or know somebody's that's in need, please refer them to that.
Any questions for Liz? All right, we'll move on to CCS satisfaction survey. Val?
Hello, so every year we do a state satisfaction survey. It's a required part of CCS, and it's, the state is, this past year is continuing to use the standardized MISA, which stands for Mental Health Statistical Improvement Program. This is used by SAMHSA, the federal government, in their state-by-state comparisons. And these surveys are all aimed at folks that have serious mental health conditions or substance use concerns who have been in our program for a minimum of 6 months. The surveys have a wide variety. You can see in the handles the different domains, but it really focuses on questions about the services provided, how these services impact their life, and then about relationships in their life. This last year, the state has allowed us to administer the survey a little different. Before, we had to do it in the fourth quarter of the year, every year, around all the holidays. It's a busy end of the year, it's a busy time for both participants and staff. So we decided to go with a new option that they had this year, which is you could do it ongoing. And so what we've chosen at our semi-annual, so every 6 months, we do a service planning, and in our separate semi-annual service planning month, we administered them. It made a very big difference, and our response rate went up significantly. Our response rate went from 62% in 2022 to 76% in 2023. And then there were some other things we put in place last year. Can you go to the other one?
What other one?
Yeah, really, the one up there, yeah. So this one here, the dark blue, shows the 2023 response rate, and the turquoise is the 2022 response rate. And you can see that also in 2023, we had better scores, better satisfaction rates than we did in 2022. And there's a lot of things I think that can contribute to that. We have been able to contract with more contracted providers to provide the services we need. In fact, we're almost to the point, knock on wood here, in the next couple months that we will have enough providers to provide every service in the home and community that our participants might want that is clinically appropriate. Which has been the first time since before the pandemic that we've gotten there. So that, I think that makes a big difference. Also, this last year, we had, based on results from 2022, we had as one of our program goals that we were going to help people with social connection in particular. We had, one of the service facilitators told us that they had been talking with somebody, and this was towards the end of 2022, who said, you know, I still haven't left the house yet. I never was very good at making friends, but I don't know how to do it. So we really had a focus in 2023 of helping people with meaningful social connections and things they could do even after discharge. So this is skill building. So, and we have a wonderful community. We've got the Breading Center, we've got the Senior Center. We've got, churches have all sorts of quilting groups and things that people can attend. And so I think that's made a big difference too. In addition to our staff focusing on that, we educated our providers and asked them to step up their game in helping people make friends. How do you make friends? I think that really made a difference. So then if you go to the next one, the next one is just how, so the blue that's listed there is what the entire state of Wisconsin's response are. And that column off to the right shows what our response was, our satisfaction rate was. And we were the same or above in everything but the last one, which is the perception of functioning. And this is something that was also brought up by staff this year when we were talking about our 2024 goals, was noticing that we have people, we're building skills with them, they're doing better, but I think they're like us, where we have a tendency to look at what's not been done yet, and what still needs to happen. And so one of our 2024 goals is to help people have more of a positive outlook. And so, yeah, they still may not be in the housing that they want to be in, but look at all the applications. And now where to go to find what's available for housing. So we don't just do it for people, we teach them how to. So that if they're homeless now and we're helping them find a house, they've got a skill that they can take with them. Even when they're not in our program, if they find themselves in a place where they need a new place to live, they know where to go to live or to look for it. They know how to fill out an application. They know what the whole process is like. I think that's it for the satisfaction survey. Any questions?
I guess not really related to the questionnaire here, but something you said, as far as these people that don't feel they are capable of making social connections. And something else you pointed out is our community is blessed to have some things like the senior center. It would seem to me that that's an area we as a group could help and provide a grant for Laura, you know, what is it, $10 a year or something? It isn't much. And I would think we should look at budgeting some money to give grants for those people that might need a little help headed in that direction so that they would actually use it. I'm guessing it might be financially tight for them to do it, but if they had a membership, they could figure out how to ride the BART bus and the aging unit bus and realize that's someplace they could go and it doesn't cost them much money.
And that's the other thing that we do. We don't bring them to the senior center. We help them figure out how they're gonna get there.
Right.
And we'll hop on the bus with them until they get comfortable with that. We'll walk with them until they know how to comfortably get there from where they live. That kind of thing. But yeah, the average income from our folks is Social Security disability, which is $914 a month right now.
Everything's very tight for them.
And that's housing. That's, food.
I would ask that maybe you could come up with some kind of numbers or something. It's something we could look at budgeting into this next year, if nothing else. And in the short time, you let me know how many people we might be talking. I'd stump around for a donation for that, if nothing else. But I think that's something we could do to help in our community right now and wouldn't take much to do it.
And I'd also like to introduce Terry Obiska. So she's our clinical coordinator, our service director for the community service programs. And you'll probably be seeing more of her in the near future.
Thank you.
Any
I don't know what
more
you're talking
questions for
about.
Val?
I do know Dr. Horning had some questions about CCS and housing. Did that kind of show you some of the things that they've been doing, or do you want more detail about what they help our participants do
We
for
do a
housing?
lot with folks around housing, and we're very connected in the community. A lot of our, the homeless, we work with homeless people, we always have. We have a few homeless people who choose to be homeless, that's because of trauma, thought disorders or whatever. And then we have the majority of the homeless people we're working with are homeless. And a lot of times, despite our best efforts in helping them, in working with them side by side, it is really hard to help somebody who makes $914 a month find housing in this area.
That's affordable, yeah. I mean, and the waiting lists for housing and all of that here are very long. We help them to fill out those applications and get on it, but it takes a really long time.
So most of those referrals, and we get referrals from all over the place for homeless people, but most of those referrals come from the inpatient behavioral health unit of Tamarack Health. We have a very good working relationship with the social workers there. They try to get referrals to us, so we go up there and we do the intake before people even leave the behavioral health unit. So then if we've got somebody who's homeless, we can set up, how are we gonna connect? Because that's the hardest part about somebody who's homeless. And, what ravine are you sleeping in? Where, and we go to that ravine. And if they don't show up for an appointment, we go to the bench they usually meet us at. We go looking for them in the places that we know of. And a lot of times they have a family member or somebody that we can call who can get them a message, those kinds of things. And so we do that. The other thing we do at the behavioral health unit is the Bayfield CCS program goes once a month, and the Ashland CCS program has a staff member go once a month to the behavioral health unit to a group that's for the people who are in the behavioral health unit to talk to them about CCS and what we can offer them to see if this is a good fit. The other thing we are very connected with the Wellness and Recovery Court. Most weeks we have a staff member who goes and attends their team meetings so that we can coordinate, collaborate on the referrals we're sending both ways.
Yeah, I've worked with Anne through this last month, so starting in March, we'll have a staff member going 3 out of the 4 weeks out of the month for staffing, plus they'll be bringing up referral paperwork and so forth, so they can talk to participants about the program, and hopefully if they want to do a referral or are interested, we can get that started for them, so.
And then for many years now, there's been a monthly community behavioral health meeting that a lot of folks in this room attend here from Ashland County Health and Human Services, but also the provider community, North Lakes, Tamarack Health Behavioral Health Unit, the tribes attend, the BRIC's been there, New Day Shelter, North End College, North End Counseling, Northwest SEP, Millie Roundsville from the NWCS attends, and we have lots of conversations in that meeting about homelessness and what how we can support the homeless population who are mentally ill with substance use. So there has been a lot of conversation, and then I personally talk to Millie about once every couple months, just so that she's aware of what some of our folks are experiencing, our participants are experiencing. We are looking forward to the new transitional housing. I think that's going to be helpful. The 50 unit thing is going to be very helpful. But the thing we really need is this affordable housing for people who live off of social security disability. We also have referral processes we set up with the homeless shelter. It goes both ways. They refer to us, we refer to them. We go right into their building, into their community room there and meet with folks. And we also have been part of Catch. I don't know if you guys are aware. Shawamba can help I don't know, what does that stand for? Accountable Community of Health. And so with that, we've set up safety plans that is held in a confidential portal that law enforcement can access. So, and the safety plan describes what that person wants to have happen if they have law enforcement contact. And the first half of it is really focused on, this is what it looks like when things aren't going well. This is what would help me. And then the last half of it focuses on, if I am gonna go somewhere, make sure my next door neighbor's taking care of my cat, kind of thing like that, and those kinds of things. So every person on intake within the first 30 days is offered a catch plan. And then we renew it every 6 months. So at that semi-annual review and the annual review, it's also updated. And right now, CCS in Ashland County is the biggest providers of catch plans in that portal.
Yeah, so that's wonderful and really helpful. Yeah, I mean, I guess, yeah, that's useful. I guess I'd like our group to have like a bigger talk, kind of going along what Matt brought up at our last meeting. And maybe, yeah, this is just my own like ignorance, but I hear from people often about homelessness, especially in the city. It's in the newspaper, it's city council every time they have a meeting. And I don't know, maybe every person that's sleeping in Pearson Plaza and under that tunnel and on the lake walk has a CCS plan and is known to your office. But I don't think that's true. And I would love for us to be doing some outreach. I feel like we as the county human services department, that we're the connector there. We could have backpacks on and we could be sending staff out to get to know people where they are. Yeah, try to get everybody into CCS if that's our like main way of helping these folks. That's willing to do it. Obviously it's voluntary, but yeah, and so that was part of my like, yeah, I was talking to some friends this weekend. I was just like, you know, if a referral from a physician is the barrier, how do we like get rid of that? We'll put a backpack on a physician and send them out with a social worker. Because so many of those people I know see law enforcement and I know they see EMS, and some of them that end up at the hospital then I think can get like sucked into this, or they're in jail and maybe somehow they get sucked into some of this too, but until they get to those spots, you know, that's where you see these cities that have social workers going out with EMS or law enforcement to try to like, what do you need? And yeah, so I guess maybe the department already has thought about all this and has talked about it, but yeah, I was sitting there and I was like, gosh, I'm on this board and I don't know how we're doing outreach to those people that we see that are struggling and need what, yeah, I think this group is maybe best like positioned to like help to connect them with or offer them. And so I guess that was my email to you and Clarence after I saw this agenda. And yeah, so this is super helpful to hear all that, but yeah, I guess I'd love for, yeah, I don't know, maybe the group doesn't want to engage on this, but.
Well, I think our CCS program would be open to that. I mean, we do want to do outreach. I don't think we ever really talked about going there, but I think that's a great
Well, if that's,
idea.
you know, and again, I don't know what all the barriers are, but
We need funding. Because CCS would not pay for that, so we would need funding.
and there again, if, because I know the county's talking about this, a bunch of you all are county board members, and yeah, if this is the venue that puts this on the agenda at county board, this is what CCS needs or HHS needs to try to do this better and connect with, yeah, City of Ashland Police, Ashland County Sheriff, yeah, Ashland Fire, all those different groups. And there, some of the connections are there, but yeah, if it's an ask that, yeah, we need 2 positions or we need, you know, this much staff time, yeah, I'd love for us to, yeah, kind of put that out there. This is what, yeah, we're trying to address this problem and yeah, but what we need is more money, if that's the answer.
This would probably be a good position for a peer specialist or a coach.
Yeah.
Okay.
I'd kind of in the same line, I'd ask, and I know Wisconsin, apparently we can't do this, but they do it in Minnesota. What would it take for us to get a detox center? I mean, because some of them, you know, we don't have an option, you know, with our police department, they can arrest them at some point. But, you know, like you're talking about, if there's something we could do to intercede that,
Well,
and the detox is a big issue here.
the group that she was referencing, that put together the catch plan, that was huge in what they identified and wanted to do. And again, it's finding somebody who will do it. You know, it's usually a hospital, because there's medical components with detox. And right now with HSHS and all those in the western region at peril of closing, you know, saying they're going to close, I hear there's talk about trying to put 15 million towards them and boost them so they stay open. But it would have to be a little more central than Ashland, because you would need to be able to funnel people in there. I agree with you. That's been something that was identified as well.
Is there something that prevents us by state law from having a detox center, or is it just basically a lack of revenue for the organization that would do it?
I hear anecdotally from behavioral health unit, they lose money hand over fist in
Oh, yeah.
that unit. So that's a huge thing.
But we're gonna pay it one way or the other. I mean, you know, you look at both ends of it. So, you know, if
It's
there's
a-
something we could do,
For somebody.
who do we
take
need to
that-
start talking to?
So it's typically gonna be somebody like a hospital administrator that would take that on.
So if we could get a hospital to do it here in Wisconsin, we could do it, we wouldn't need a law change?
They
No,
do
there's
detox at
detox.
BHU.
Yeah.
Okay.
Yeah, right now,
Yeah.
Tamarack does alcohol detox.
Okay.
So we do have that. What we were identifying in the catch plan was so many of the people, and we've done a lot of progress. I wish Tasha was here to talk about it, because we have regular meetings with law enforcement, our department. A lot of the folks that we were doing emergency detentions on were having a situational crisis because they were on alcohol or drugs. And once they sobered up, the dangerousness goes away, and then you don't have any cause for an emergency detention. So oftentimes you could avoid all of that and just transfer them directly to a detox facility. And then get them into services and hopefully get them into rehab from there. So that's, that is our vision.
So how do we realize our vision?
I think you'd have to do a lot of outreach with, you know, to find out who's willing to take that risk. Do you have any kind of benefactors who would be willing to fund it? Because, you know, if you have these huge hospitals like St. Joseph's and Sacred Heart going under, I don't know that a lot of people are willing to take that risk right now, so. Yeah.
You see, there's something in the chat.
It's been there for quite a while.
Oh, I'm sorry. Laura,
Any other questions for Val? Okay, we'll move on to jail mat grant.
so good news. I don't know if we had informed everybody here. It was really on a fast track last fall. We had applied with the jail for a medication assisted treatment program in the jail. We were hoping to hear by early December. We just heard a couple weeks ago that we've received the grant.
That's great.
So it's, we asked for 197,000 and they graciously gave us an extra 10, but also gave us more things that we have to do.
It's always strings attached.
Yeah, so, we're very excited. We have a good plan in place, which will include, when anybody is being booked into the jail, there's an intake and a screening process to determine who may be appropriate for medication assisted treatment. That the options would be, buprenorphine, and naltrexone, and methadone. Methadone was a concern to us because the nearest clinic to us is Duluth. However, it wasn't as onerous as we thought it would be. I talked to the clinic up there and we only will have to transport an inmate up there once. And then if they're appropriate, we can go either weekly, every 2 weeks, or monthly to pick up methadone for the inmates who are prescribed that. We can store that right at the jail and dose it out there. In the future, they said there's legislation that should be, it seems to be on a very fast path that will allow them to even do the initial intake by telehealth. So that's very exciting. That will really open it up for not just our male, our inmate population, but everybody in our area, so they don't have to travel so far. And if that's the treatment of choice, they should be able to get it. And then we're going to provide group therapy twice a week in the jail. We will have a certified peer specialist or a recovery coach who will be going in there full time on a daily basis and making those connections with people, building rapport and trust, trying to get them interested and agreeable to the CCS program so that when they come out, we can have services in place. There won't be a gap. And again, when they are released, we will offer them Vivitrol injection. So that's a suspended release dose to help with the sustainability. So you don't have to take a daily pill. It's good for 28 days, which really should enhance their sobriety. We applied for a grant to fund some substantial room and board costs for people who have Medicaid. So if we get that grant, we should be able to also offer inpatient rehabilitation stay for those who are agreeable to that and want to go, and then have the funding for that through MA and then this grant. What else am I missing? I think yeah, so we're very excited.
Sounds good.
Yeah.
Are you gonna connect with North Lakes? Or, I'm just thinking all the people on buprenorphine will do well to be like plugged in with the local provider when they're
Oh, yes, that was,
discharged.
we did miss something. Yes, so before they're discharged, we will be working to make sure they have Medicaid for when they come out, if they're eligible. All their appointments should be made for them. We'll make those connections to whatever clinic they're with. So there shouldn't be a lapse in their
Awesome.
care.
Yeah. Cause while they're in the jail, the provider will be doing the prescribing, but there would be essentially discharge planning that would take place prior to the release. So all of that would be established and set for them.
Awesome. Yeah, that's great.
Very good. We'll move on to written materials. You have them in your folders. Anyone have any questions about any of those? Or supervisors want to make comments?
I guess I'd like to make a comment about the cost of children in substitute care, just a couple of things. If you notice in that top chart, when you go from December of 2023 to January of 2024, there was a decrease of 6 children in out-of-home care. We ended up in that span of time doing 3 subsidized guardianships. So bringing all these were kids who were brought to permanence. So 3 subsidized guardianships, 2 straight guardianships, and 1 reunification. And the reunification was a kid that we had in a residential care center at about $18,000 a month, who had dropped down to group home care and is now back home with his family. So we're really happy about that. The great thing about, and I think I mentioned this before, the great thing about the subsidized guardianships is that while it still shows up in the numbers, it shows up in our system as a placement yet. However, that money is reimbursed to us by the state. So it ends up costing us nothing once we're able to do a subsidized guardianship. That being said, just found out last week, and I mentioned this previously, that there was legislation out there. I think it was Senate Bill 520 that had to do with changing some language as far as what it means to be like kin and being able to place with a person that's not necessarily a relative. that has passed both the Assembly and the Senate, and it has gone to Governor Evers' desk for signature. So hopefully that will open up more doors for us to do more subsidized guardianships and be able to recoup some of that money that we've been putting out.
And keep kids with faith.
And
in
keep
life.
kids with light
Yeah.
and with faith, yes,
Mhm.
absolutely. And then just one other little thing, you might look at the second chart when you get down to November and go, what the heck happened there? Cause you notice that it's a significant outlier in terms of the cost there. What that was there was an error with one placement. There was actually, we had a child in placement, the person became the child's legal guardian. And then we stopped our kinship care payments and referred them to the county that they now live in, which is in, I don't remember where, way down south, down by Milwaukee. And we had referred them to go to the other county to apply for kinship there. Well, as it turns out, the other county denied them. We didn't find out about it until sometime later. And we ended up having to go back and make payments to that provider because it should have been our kinship care case. And that all ended up getting piled up on 1 month. So that's where that weird number comes from.
Anyone else? Anything to say or any questions? Board member updates and possible agenda items. Yeah, George?
Yeah, I would like to request a future review of something that's not a problem for us right now and hopefully never will be. But to lead into this, you'll recall that we had a lot of smoke in our atmosphere last summer. And I'm old enough to remember back in the 1950s when we worried about, there was a lot of atmospheric nuclear testing going on in the 50s. And we worried about our milk supply because of atmospheric fallout, on the grasslands in on our food supply. So I've also, I've been to southeastern Poland and seen the birth defects resultant from the Chernobyl disaster. So this is something we hope never happens, but if something ever did happen, it would happen very quickly and be very quickly upon us, just like the pandemic was very quickly upon us and could catch us unprepared. So at some point, an agenda item down the line here, I'd like to see where we stand on that and what our contingency planning would be if a missile silo blew up in North Dakota or a power plant in Calgary went awry and that air, came our way. It would be a very sudden and unfortunate and catastrophic kind of event that we have to deal with. And it would be a huge public health issue.
It's interesting that you bring that up, George, because we just recently went through an emergency preparedness exercise. And that has kind of, I think, prompted Liz to get together with our emergency government folks and really start plowing into those planning things. So
There are plans in place as far as contingency plans, emergency operation plans. I think we probably have plans for just about everything in some way, shape or form. It's just a matter of kind of dusting them off and making sure they're up to date, but there are a various array of emergency preparedness plans, anywhere from natural disasters to chemical warfare type of plans.
Yes, the question is, do we have a little review of how it would work, what our response would be? Because if we have a plan, we know what our response would be, then we can ask ourselves, would we have the resources available to carry out the plan?
We do have regional activities and exercises, usually in the form of a tabletop exercise that happen on some of them are more local, but typically it's a regional basis where there's a, scenario, whether it be small scale or large scale of, tanker spill. Last year we had one with the Western Region Public Health Emergency Preparedness Consortium. And that was Chippewa County, I believe it was. The scenario was a essentially a nuclear disaster in Chippewa County and what the emergency response would be as far as that. So there are exercises that do go on in relation to that throughout the state on a regular basis as far as planning exercises.
Okay, any other,
I would just like to thank Matt for the years that he's been on our board. I believe this is his last meeting with us.
Unless you call a special one, I think.
So
Thank you for
thank
putting
you
up with
very
me.
How many years has it been? I was trying to figure it out and I just couldn't.
Too many and not enough. I don't know.
Thank you.
we already are eyeing his replacement.
Yes, I heard that.
Clarence, I have a question, or maybe a concern. I noticed in this agenda that public comment was only going to be allowed for things that were on the agenda. And I just hadn't seen that in maybe a while, and so I'm concerned that, you know, if people want to come to talk with us, that 3 minutes really isn't that long, and so I'm just concerned about that.
That's a county-wide thing. We do that same thing at our county board meetings and all our committees.
I
Have
think
that.
there was an issue of a repetitive,
Yes, that's what
Yeah.
happened, yeah.
Yeah.
the same topic being brought up by
Yeah.
the same people.
Again and again and
Again and
again.
again.
Almost every board meeting, yeah, so, and nothing was on
Okay.
it.
Because I
Yeah.
just hadn't seen that in previous agendas, and so I just was concerned that, you know, is something going on that I missed, because I've been sick, and so I just wanted to follow up on that.
We just are trying to be more consistent.
George?
So let me comment on that. So for Land Conservation Committee and UW Extension Committees, we've added to the agenda an item for public access after the close of business, during which no business can be conducted, but people would be available to speak with members of the public if they wanted to talk about just about anything. So
Oh, I
something
like
that
that.
will be done here and is being done on those two committees currently.
Thank you. That's nice to know that there's some committees that are doing that. Thanks.
People can always get in touch with board members if they have a question about something or. Anything else? First thing we have to do is adjourn our public hearing.
Yeah.
I'll make a motion that we adjourn our public hearing.
Laura Prue, second.
Or Laura, yeah.
And this one I don't think needs to be a voice vote. We just. It doesn't need to be a roll call vote, just a voice vote. All in favor of adjourning the public hearing?
Aye.
Aye.
Opposed? Any other business?
Move to adjourn.
Second, Laura Cruz.
Motion made and seconded to adjourn. All in favor?
Aye.
Aye.
Opposed? We're adjourned.
Thank you.